Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine in Pennsylvania for our members and their patients. Thanks for tuning in.
Hello, everyone, and welcome to our newest episode of the POMA Does podcast. We're glad that you're joining us today and listening once again. Time in the year to focus on medical students, a very important aspect of our POMA membership, and the all-important, entering into clinical rotations. So I have with us today a group of third-year medical students from the Lake Erie College of Osteopathic Medicine. We have Alexander Nguyen, Nick Debik, and Vartan Matosian, as well as Dr. Anna Antonopoulos, who is joining us actually all the way from Oregon. Anna and I are friends from residency, and we both work as pediatric hospitalists. So we are with this group of students today to hopefully provide some reassurance and stress relief for those of you listening who will be starting your clinical rotations coming up shortly. Nick, I understand you had some questions, a particular question for us.
All of us have questions, and I'm hoping you can really provide that stress relief, because I'll tell you what, going from 2 years of book work right into the thick of everything, like having to help patients and be with attendings and such, it's very, very scary. But at the end of the day, we all know we need to do well during these third and fourth years to be into the residency that we want to be into. So with that being said, while we're on rotations, what is something that we could do as students to stand out amongst the other students? Not to hinder them, of course, but just for us to stand out as our own future position.
So for me, as a community hospitalist, we get one student at a time, and we don't have residents. So it's just the attending and the student. And I can tell you the biggest thing for me is when I meet a student, I guess it gets to me when people right away say, oh, I don't have any interest in pediatrics. I'm just doing this because I'm a third year and it's required. Great, but you're still going to be with me for the next month. So I think the biggest thing for me is, before you go into a rotation, even if you're going to go into some pathology or anesthesia, or if you're like, I don't like kids, they scare me, just read something about it, hang out with some kids, just try to go into it. Like I've had medical students who have come and they're like, I really like ortho, but I'm going to learn as much as I can on this rotation. Great. Go into it like in the mindset that, hey, maybe you're not going to like kids, maybe you're not going to like this attending or whatever, but just try to go into it wanting to learn something and have a positive attitude. Saying things to me like, oh, I'm going to go into anesthesia, so this is probably the only time I'll ever see a kid with Down syndrome. Nope. Try to stay away from like the negative stuff and just go into it with a really positive mindset. Like I remember when I was a medical student, there was things I had no interest in adult infectious disease, none, but I still went into it to learn and to bond with the attending and even with the patients in some aspect. And I think that really, there's things that I remember now from that. And I think no matter what rotation you're going into, you just have to have a positive mindset and just know like, oh, like I'm going to learn something. Like, I just want to learn something, even if I have no remote interest in this whatsoever.
Yeah, I would absolutely second that. One of my best rotations actually in medical school as a third year was surgery. I am not a surgeon. I never even pretended to want to be a surgeon by any stretch of the imagination, except maybe to, drain some abscesses or something like that. But that was my best rotation. Well, it was probably one of the rotations that I learned the most on and that sort of thing. So absolutely, even if you think you're not going to learn a thing on this rotation because you want to specialize in something, that sort of thing, I echo exactly what Anna in terms of going into it with a positive attitude. For me, the thing that stands out is the students that are prepared, have an idea of what you're going to be looking at on this rotation. If it's possible to talk to some of the other students that have rotated with this preceptor before, get an idea from them from what to anticipate. I mean, that can be helpful for you. If this attending likes to work through lunch, then maybe you pack an extra protein bar in your bag or something like that, versus, we take hour-long lunches or something. Read up on some common things that are seen with that rotation. If you're going into surgery, basic stuff on appendicitis, pancreatitis, obstructions, that sort of thing. So yeah, the student that's prepared really does stand out. Like we've talked about already, if you have no particular interest in pediatrics or surgery or whatever it is, being prepared is a good idea.
I like those roles.
If you see a patient, like let's say that you go in on your first day of peds and you see a kid with intussusception and you've never seen that before, you maybe read about it a little bit. Well, at night, go home. I'm not saying spend hours, but take 5 minutes, just read a little bit like about it. And just so that way, like you have a bit more knowledge. And the next day when your attending talks to you about it, you can add something, or at least you like take an interest in the patients that you're seeing. And I'm not saying like go home at night and read a ton, like we all have to have lives outside the hospital, but just a couple minutes.
Absolutely.
I guess that kind of ties into like a question that I had. Like you were saying, you appreciate the students who are prepared and that's what you look for. But it's like, what are like your expectations of a student who is like rotating with you? Like, cause like we're more than just like shadows now. I imagine that like you would expect some students to like be responsible for some tasks, be proficient in certain common things, but like this is our first time maybe like having responsibilities in a hospital setting. So like, what would you expect from them and how would you advise them to prepare for that? Like outside of like just clinical knowledge.
I think the biggest thing that you can take away from your third year rotations is how to do a good history and physical exam. And that's pretty prominently discussed in medical education because we do talk about that. The goal of your third year is to learn how to do a great history and a great physical exam and present those succinctly enough to where, you can talk to if you have fellow students on the rotation, residents on the rotation, or just your attending, talk to them succinctly and quickly about those findings. If you start to have some sort of differential, that's great. The attendings want to know that you have some idea of what's going on during your third year. Fourth year, we're hoping that you're starting to make some conclusions on your own, but third year, we want to know that you can go in and get a good history and a good physical exam, and then maybe start to draw some conclusions about what could be going on, or even some next steps. Do we need lab work? Do we need imaging, medicines, that sort of thing?
So for my group, we work with one student at a time. We don't have residents, and it's attending with the student. And so what we do is we talk to the student the first day to say, hey, where are you at? What is your pediatric experience? What do you feel comfortable with? And so I will, if it's the first day with me, the student's probably going to be more like a shadow. But if they show more initiative, like I might say for this HMP on this kid in the ER, why don't you come with me? You can watch what I do. You can, listen to what I ask. And then the second one, why don't you go by yourself? So for me, it's all more of a discussion with the student, what they're comfortable with, and then what they show me. Like if you take initiative and say, hey, you told me that there's a kid with an abscess in room 2. Can I go see that patient first and then present to you, and then we can round together? Like if a student said something like that to me, I'd think, great. I will tell you my expectation, which I think a lot of students, or I don't know if this is the culture, like I don't expect you to be my servant. Like you don't have to get me gloves when we're going into a room. You don't have to take the trash out of my office, which I had a student offer to do that the other day. You don't have, like, I try not to give you kind of grunt work. Like I might say, hey, can you look through this pack of labs that we got from the outside hospital and help me find the white count? Because, and I'm searching too. But I'm not going to send you on a list of tasks that like, oh, can you go print off 10 things? And no, like, so that is not your job. Now, you may have people that have you do those things, but just know, like, your job is not to be my servant. It's to learn as much as you can and to learn about the subject that you're on, but also to learn how to be a doctor. And you're going to see a ton of attendings in third and fourth year, and you're going to learn like, oh, I really like what that person did. I don't like what that person did. And you're eventually going to learn, how to be your own.
Absolutely. I kind of forgot what the original question was. But that's all things that I've thought of myself and that sort of thing. And I'm going to reiterate, you're going to have attendings that approach things differently. I tend to approach things similar to how Anna does it. What's your baseline? What's your comfort level? What have you done before? What do you need help with? Some people may just expect you to go in and start doing things. So sometimes people learn well that way. Sometimes people don't. So that you'll have a variety of attendings in your rotations, and hopefully you can glean something important from how each one of us approaches it. So Vartan, did you have a particular question, I think?
Yeah, so kind of in line with what you two were saying about, getting the most out of the experience and making sure that you're learning. I feel like third year for some of us who are pretty undecided is sort of soul searching, trying to see what you actually like. So, I mean, aside from the learning, is there anything you would recommend as a student we should either be looking for or actively doing just to see, is this something I'm interested in pursuing? Is it something that I'm just learning from? Just maybe some sort of something to look for on that.
I think keeping an open mind is really, really important. Actually, my son asked me the other day what I wanted to do when I was 12, and I actually said I wanted to be a pediatrician. And that was a really random question out of nowhere. But I did go into third year. I started off with 8 weeks of family medicine as a third year student, which was fantastic. And I thought, this is pretty interesting. I could do this. I liked the variety and all the things that go along with family medicine. So I think keeping an open mind as to the possibility of, you might actually like something that you don't think you'll like. You might, find out something that you really, really enjoy. And then I did my pediatrics rotation in December of all things and got sick from it, and I still became a pediatrician. So I think too, for those of you that are soul searching, I think that's a great term. I think you need to be open to the fact and kind of be looking for that little gut feeling that says, okay, this is it. I think that'll happen for a lot of you. It may not happen for everybody, but I think that will happen for a lot of you. It was like, okay, this is what really speaks to me.
So mine is actually kind of a similar story. I've been telling everyone since I was the age of 2 that I was going to be a doctor, and that I was going to be a doctor that delivered babies. So I was gung-ho OB, like nonstop. So I went to Michigan State University Osteopathic, and we had the ability to kind of choose what rotations were first, second, third. And I thought, I really like the OB part of it. I'm not quite sure about the gyne part, but I'm going to do OB as my very first or second rotation, something like that. And when I did OB, I really liked the babies, but the rest of it, nope.
Not it.
I quickly kind of scrambled and was able to get inpatient, a pediatric rotation that February, which I also got RSV. So that was a blast. But it was more, I think, if you are soul searching and just kind of like, I'm not quite sure what I want to do, if possible, think about anything you're like, oh, I might want to do this, I might want to do that. Have those rotations kind of on the front end of your third year, if you can, because that way you can get a sense of, is this something that I like or I don't like? And then when you're on a rotation, I would pay attention to the attendings around you. Like, do they like their life? Do they like their job? What's their lifestyle like? Is this something you could see yourself doing? Is this something, in radiology, sitting in a dark room for 10 hours a day? Would that just kill your soul? Would that feed your soul? I mean, think about those things as you're on the rotation, not just the actual medical side of it, but because you're not going to be a student forever. You're not going to be a resident forever. And honestly, you're not going to have debt forever as well. So
it feels like forever on all those so far.
I know, it totally does. But believe me, you won't. And eventually you're going to be unattending and you're going to be a doctor and you're going to have to be living this life. So as you're on rotations, look at the people around you and, is this something that I could see myself doing? Does this fit with me and my family or my future family or whatever? But just look at that.
That makes sense. Thank you.
Absolutely.
Oh,
I
that's
second
a
all
good
that.
take.
That's perfect.
Yeah. Yeah. Whenever, prior to coming to medical school, or even throughout medical school, when you shadow a physician, you're more worried about the work that they're doing and trying to learn from them instead of evaluating their mannerisms if they're truly happy in what they're doing. So I like that a lot of what you said about them. Definitely take that onto my rotations. One of my questions that I had, this is going to happen a lot, I feel, not in a negative sense as an MS3, but mistakes are going to happen. Whether you call a diagnosis wrong, you call a medication wrong, or you make a suggestion that's just, it's just the incorrect answer. What is the best way to go about getting something wrong and learning from that? Maybe something aside from going home and reading it that night, and maybe use something along the lines of when we're being pimped throughout rotations. What's your guys' evaluation on a student who gets something wrong, and what do you expect them to do that following day, week, or however you would evaluate them?
The main thing is to not get it wrong the next time. So just remember it for next time, especially if it's something, super common. It's a horse, not a zebra. So we're going to use a lot of pediatric examples of this discussion. I'm really sorry about that, but that's what we do. That's what we know. And an asthma exacerbation is a common thing to see in an inpatient pediatrics rotation, and if each and every single time you try to give me a differential that includes some sort of, weird aspiration or
Alpha-1 antitrypsin.
There you go. Thank you.
That's like 10% of my U-Board questions though.
Yeah, I was gonna say, I thought those were really common. Wait a minute.
No, yeah. Oh, very first, we'll take everything that you just studied for your board exams and put it in the back of your head, because that's zebra stuff. You want to know what the horses are.
Right.
So if you try to give me that as a differential every single time, I'm going to get kind of bored and a little annoyed. But I want you to learn, oh, hey, this is a kid presenting with respiratory distress and wheezing and increased work of breathing. It's likely to be an asthma exacerbation or bronchiolitis or pneumonia, something along those lines. Learning from your mistakes, basically, I think is the biggest thing that you can do. And then too, if, you're discussing, say you wanted to start a medication and the attending says no, and doesn't provide any reasons as to why you wouldn't want to do that, go ahead and be proactive and ask, okay, well, why isn't albuterol the best medication to start at this point in time in a wheezing broncholytic, that sort of thing. So why wouldn't you do that? I find personally that I remember things a lot more easily if I remember the why we wouldn't do things and that sort of thing. And I also remember a lot more things if I screw it up in the first time. So you would take advantage of those moments.
Don't get it wrong twice. Noted.
Yeah.
So for me, I think when you're going to get something wrong, I think it comes down to humility. I think knowing that you're going to get things wrong, knowing that you're not going to know an answer, and that's totally fine. But the one thing that always gets me is a student who will challenge me, listen to your attendings because they do have a lot of experience and knowledge. And it's totally fine to be like, why would we use this medication, or why wouldn't we use this, or why do you call it that, something like that. But challenging me in something that's really simple, it's not going to go well. So it's totally fine to not know things. It's totally fine to get things wrong, but use that as a springboard to learn and to not get it wrong the next time. But also challenging your attending, that's never a good way to go.
Yeah, that doesn't sound too positive to be asking those kind of questions and challenging them. Alex, I kind of went with your next question, doesn't it? With how to ask questions or how much to ask.
Yeah, so that does. So I don't think I would have the goal to even challenge an attending, even if I had the facts textbooks in front of me. Yeah, so my question was I think everyone is kind of afraid of pimping, being put on the spot. Can you ask a question? Can I answer? I was like, maybe. It's a lot of times I would rather not say anything than be wrong. But that's just how I am. I don't know how other people are. So if you were asking a student a question, what would be the perfect way, if besides a correct answer, that you would want a student to approach that situation? Would you say, I don't know, or would you want them to say a wrong answer?
I think either one, depending on the situation, either one's okay. I don't know is a perfectly acceptable answer. Okay. I don't know. I could read on that tonight. I don't know. I'll look it up after we're done rounding, that sort of thing. All of that is a great answer. I wouldn't say anything at all, because part of the reason why we ask you those questions on the spot, number one, as a physician, you're going to have to be able to think quickly sometimes. Okay. And so we're trying to develop that process. Number two, we want to see where your head's at. If we're thinking asthma and you're thinking alpha-1 antitrypsin deficiency, we need to know how to rein that back in. And, are you thinking something super, super uncommon and we just need to have you tone it down a little bit? Are you not thinking anything at all? That sort of thing. We're asking those questions so that we can guide your thought processes a little bit better. So have an answer, even if it's, I don't know.
Now, I hate pimping so much to the point that when I'm sitting down with a student, because it's just me and the student, I will ask a question. I'm like, I'm not pimping. It's totally okay if you don't know the answer, because I don't want them to feel awful because I hated pimping. But for me, I tend to ask more broader questions like, okay, so we have a kid who came in and they have altered mental status. They're really sleepy. They can't wake up. Can you think of something that could cause that? So even if you tell me like just one thing, like, oh, it could be a seizure, or oh, they could have got into grandma's medication, or maybe it's COVID. Oh, okay, just tell me something. Like, so for me, especially when I'm learning a student and trying to figure out where they're at, I tend to be pretty gentle with my questioning, and I will give you positive feedback for any kind of answer that is at all like in the ballpark. So I think just trying to answer something, not something totally crazy, but something in the ballpark is better than not saying anything.
Absolutely. Vartan, I know you had one more question. I think we have time to get to it real quick here.
So just to end on something fun, a little less stressful, but how do you recommend we pick electives?
Take the information that you've learned from third year, because you hopefully won't have to pick those until closer to the end of third year. See what your interests are, and then go from there, in terms of specialty. And by that point in time, you'll have developed a pretty good support system in terms of fellow students and other residents and that sort of thing. Learn what's good, learn what's bad, learn, the worthwhile rotations and everything like that. And I think it'll be pretty straightforward.
You will hear a lot from your fellow third years. Oh, this rotation with Dr. So-and-so was so cool because they let me do XYZ, or, this one was great. Even if your electives are going to be at the end of fourth year when you've already matched, take something that will be interesting, something like that.
Okay, that makes sense.
I think that's all our questions for today. Hopefully you've learned something listening to our podcast. There is so much more. We could probably go on for another hour and a half, probably, about all the things that you can learn on your rotations. And maybe we'll do the second episode somewhere down the line. But thanks so much to our students for joining us today. And thanks to Dr. Antonopoulos as well for joining us all the way from Oregon. And good luck, everybody, with your third year.
Thank you. We
Thank
appreciate you
you.
both.
Bye.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube, or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.